even in so-called hopeless cases, which was former times told that it's contradiction. It's no contradiction. You have possibilities to break through chemoresistance, as I told you, slowing down tumor growth, promoting extreme quality of life, and cutting down on pain, diminishing nausea. That are things which we regularly see even in so-called hopeless cases. Now, as I promised this morning, I will show you a few pictures. That is Hodgkin's lymphoma cell line, and now you see, we added mesenchyme extracts before a lot, and after we added a few, actually one day, 24 hours later, it's less. And then now, 3 days later, you see that picture. So it's dramatically going down, and those mesenchyme extracts are actually killing all those Hodgkin's cell lines. So after another day, all were gone. So just as impressive how powerful such a therapy can be, even in Hodgkin's disease. Now, also the amount of, during a chemotherapy, T-cell, we have here, with cell therapy, under chemotherapy, still the T-cells are improving. Without cell therapy, it's going down. 6 weeks, within 6 weeks, we checked. The second week, every week we checked it. There were 72 patients. Then the natural killer cells. You see natural killer cells while therapy, they still keep up. They are not going down. Natural killer cells without cell therapy during chemo, they're going down. Then the pain reduction, opiate use. We had, while using mesenchyme, hypothalamus, and hypophysis growth factor, that mix what I told you before, we saw a dramatic reduction to less than 50% of the opiate use in tumor patients. Those were all patients with bone metastasis. Then the endorphin level, what we checked, we used a mixture of mesenchyme, thymus, and brain in a small cohort of 37 patients. It went up, it doubled from 10% from normal cohort to 30% of a normal cohort within 6 weeks. So it's a dramatic increase of the endorphin level. And as I told you before, it's nonsense. It is not seen so far that cancer cell attacks to attack cancer cells while ignoring the cellular environment. You cannot do that. This is, I have just to see, we have a patient, it's a female patient born 30th of November 1951 with invasive ductal mama cancer, breast cancer, and it's from the pathologist. It shows severe hematogenic metastasizing. And we treated it in the beginning, that was 2002. It showed low T cells. It showed low naive T cells. It showed low naive T4 cells, but high suppressor cells. So that's why the immune modulation. And we checked for immune stimulants with mesenchyme, thymus, and spleen. And the best was mesenchyme that showed the best reaction. And after 1 year,